Okay, today we are going to show you how to do a patient prep on a spay and a neuter. With a spay, you are going to take your clippers there and you are going to clip 2 clipper blade widths from the xiphoid process all the way down to the pubis. And you're going to keep that nice and even because the client's impression of the clip is the client's impression of the entire clinic as a whole. For the neuter, you are going to use the landmarks of the tip of the prepuce down to the scrotum. And again, that's 2 clipper blade widths wide. You are then, after that is done, going to get the area nice and clean, vacuum it, make sure there's no hair in the surgical site there. We're going to have 2 different prep solutions. We have the chlorhexidine scrub and the alcohol scrub. We could also use iodine. The benefit to the chlorhexidine versus the iodine, so the chlorhexidine, it acts faster, it's longer lasting, and it is less irritating, whereas the iodine is more irritating to tissues potentially, and it can potentially stain the fur. You can also use sterile water when using the alcohol instead of the alcohol. And the reason you would use sterile water instead of the alcohol is because if you were doing an electrocautery type procedure, pooled alcohol can actually cause thermal burns on your patient. So that's when you would want to opt for the sterile water instead. So Penny here is going to show you then how to do the target pattern with the alternating scrubs here.
First you take the chlorhexidine and you take your gauze and you fold it in half and you fold it in half again and then you triangle it. The one tip is solid and the other is bottom or more loose, and you take that and you scrub back and forth, and then you take your chlorhexidine and you start to go in a circle and you turn your gauze as you go around so that the solid edge is always to the outside, and you keep the clean portion to the outside so it's not getting dirty. And you go around in a circle until the whole area is scrubbed.
And that way, by keeping the loose ends outside, it's just not pulling any of the dirt that's on the outer portion inward.
Put that out to the side. And I'm going to do all 3 of the chlorhexidines in one to make sure it's good and clean. You can do it chlorhexidine, alcohol, every other one. It's basically however you want to do it, but you want to take your clean hand and grab so that you're not contaminating. You scrub and you fold that in half, and you fold it in half again. And the triangle. You scrub and you do the same thing. And slowly work in your circle. Spinning it, the gauze in your hand.
And you're going to want to scrub each of these a minimum of 3 times. It could take upwards a lot more depending on how dirty your patient is. Some animals come in and they're quite dirty versus others that are fairly clean to begin with, but always a minimum of 3.
And of course you take your alcohol and do the same thing. You can grab it. Your chlorhexidine foams, so this will kind of get rid of some of the soapy, foamy portion.
And then as you can see, as Penny goes in the target pattern, she works herself from the inside out. Again, making sure that that never re-enters the area that is already clean.
That's right. Here's the last one.
All right, and that is how we would clip and prep our patients, and then we would take them on to the next stage for their surgery.